Have you ever wondered how doctors can figure out what's going on inside you without, actually opening you up? It's a pretty important question. For a long time, the only way to get a good look was through surgery. But today, we have some amazing machines that act like a window into the human body. These machines, like scanners and special cameras, allow doctors to see our bones, organs, and even how our cells are working. It's a critical part of modern medicine. This technology helps them diagnose illnesses, check if a treatment is working, or find an injury like a broken bone. It's science in action, helping people get better. When a doctor suspects something is wrong, they need information, and a picture is worth 1,000 words, especially when that picture is of your heart or your brain. Medical imaging gives them that picture. For example, they might use a special kind of imaging called nuclear medicine. This involves using a tiny, safe amount of a radioactive material called a radio tracer. This tracer travels through your body to a specific organ or tissue. A special camera then tracks the energy, or gamma rays, that the tracer gives off. The camera turns this energy into a detailed image, showing doctors exactly what is happening deep inside you. This ability to see inside the body is nothing short of revolutionary. Think about it. Instead of making an educated guess, a doctor can see if a kidney is functioning properly or if blood is flowing correctly to the brain. They can spot problems at their earliest stages, when they are much easier to treat. This isn't just about finding things that are wrong, it's also about confirming that things are right. It provides peace of mind and allows for incredibly precise medical care. These images are like a map that guides doctors, helping them make the best decisions for their patients' health. The science behind these cameras is truly cool. They are designed to detect a very specific type of energy, gamma rays, that our eyes can't see. The radio tracer acts like a tiny lantern that you swallow or have injected, and it lights up the specific area the doctor wants to examine. The camera is a super sensitive detector that sees these lights and pieces them together into a coherent picture. This process, known as single photon emission computed tomography, or SPECT, has been a cornerstone of diagnostics for years, helping millions of people by providing a non-invasive look at the inner workings of life itself. While our current medical imaging technology is amazing, it's not perfect. There are some significant challenges that limit its use and effectiveness. One of the biggest problems is the cost. The best, most precise scanners available today use detectors made from a material called cadmium zinc telluride, or CZT. These CZT detectors are fantastic at creating clear images, but they are incredibly expensive to produce. A single camera can cost hundreds of thousands or even millions of dollars. This high price tag means that only the wealthiest hospitals can afford them, leaving many communities without access to top-tier diagnostic tools. On the other end of the spectrum, there are cheaper alternatives. Many hospitals use scanners with detectors made from a material called sodium iodide. These are much more affordable, which is great, but they come with a trade-off. The images they produce are not as sharp or clear. They can be foggy or blurry, making it harder for doctors to see very small details. Imagine trying to read a book with smudged glasses. You might get the general idea, but you could easily miss an important word. For a doctor trying to spot a tiny tumor, that lack of clarity can make a huge difference in a patient's diagnosis and treatment plan. Besides the issues of cost and clarity, there's also the matter of time and safety for the patient. To get a usable image from a less sensitive scanner, a patient might have to lie perfectly still for a long time, sometimes up to 20 or 30 minutes. That can be very uncomfortable and difficult, especially for children or people who are in pain. Furthermore, to compensate for a less efficient detector, doctors sometimes have to use a higher dose of the radio tracer. While these tracers are generally safe, the goal is always to use the lowest possible dose of radiation to get the job done. So we find ourselves in a difficult situation. Hospitals have to choose between incredibly expensive machines that offer great performance and more affordable machines that provide lower quality results. This creates a gap in healthcare, where the quality of your diagnosis could depend on where you live or how much your local hospital can afford to spend on equipment. For science and medicine to move forward, we need a solution that gives us the best of both worlds, the high performance of expensive scanners at a price that everyone can afford. We need a new way to build these amazing cameras. Now this is where the science gets really exciting. Researchers have found a new type of material that could solve these problems. It's a special kind of crystal called a Perovskite. You might have heard about perovskites in the context of solar panels because they are fantastic at capturing light. But a team of scientists from Northwestern University and Soochow University discovered something else remarkable. These crystals are also incredibly good at detecting gamma rays. This discovery, made over a decade of dedicated research, has opened the door to a whole new generation of medical cameras that could change everything we know about medical imaging. So, what makes perovskite crystals so special? First, they are much easier and cheaper to grow than the CZT crystals used in high-end scanners. Instead of a difficult high-temperature manufacturing process, perovskites can be grown at low temperatures from a simple solution, almost like growing salt crystals from water. This simpler process means the raw material for the camera's detector becomes dramatically less expensive. We're talking about a potential shift from millions of dollars to something far more accessible. This is a huge deal because it breaks down the biggest barrier, cost, that keeps the best technology out of most hospitals. But being cheaper doesn't mean much if the performance isn't there. And this is where perovskites truly shine. Experiments have shown that these crystals are not just good at detecting gamma rays, they are outstanding. They have what scientists call excellent energy resolution. This means they can tell the difference between gamma rays of slightly different energies with incredible precision. This is like having a super advanced sound system that can distinguish between two notes that are very, very close together. For a medical camera, this ability helps filter out background noise and creates an image that is exceptionally crisp and clean. The perovskite detector developed by the research team, led by Mercouri Kanatsudis and Yihue He, has already produced amazing results. In lab tests, it was able to create images with fantastic detail, clearly separating tiny radioactive sources that were only a few millimeters apart. It proved to be highly sensitive, capable of picking up the faint signals from the same radio tracers used in hospitals today. The stability and precision of the perovskite detector mean that it captures the information from the gamma rays without losing or distorting the signal. It's the high-quality performance doctors need, but from a material that is practical and affordable. The invention of the perovskite gamma ray camera isn't just a small step forward, it's a giant leap for medical imaging. Let's think about what this means for you, the patient. Because perovskite detectors are so sensitive and efficient, they can capture a high-quality image much faster. Instead of lying still for 20 minutes, you might only need a scan that lasts a few minutes. This makes the entire experience quicker, more comfortable, and less stressful. For hospitals, this increased speed means they can help more patients in a single day, reducing long wait times for important diagnostic tests. Furthermore, this new technology promises to be safer. The high sensitivity of perovskite crystals means that doctors can get a clear image using a much lower dose of the radioactive tracer. The guiding principle in medicine is to expose patients to as little radiation as possible, and this camera makes that goal a reality. Lower doses reduce any potential risks, making these essential scans even safer for people of all ages. This is especially important for patients who may need multiple scans over time to monitor a chronic condition. It's about getting the answers doctors need while putting the patient's well-being first. The biggest impact of all, however, might be accessibility. By drastically lowering the cost of high-performance scanners, perovskite technology has the potential to democratize medical imaging. Hospitals in smaller towns, rural areas, and developing countries that could never afford a $1 million CZT camera may now be able to acquire state-of-the-art diagnostic tools. This would mean that a person's access to a life-saving diagnosis would no longer depend on their zip code. It would bring top-tier medical care to communities everywhere, leveling the playing field and ensuring more people get the chance for an early and accurate diagnosis. This breakthrough, now being developed for commercial use by a company called Actinia Inc., is a powerful example of how scientific curiosity can lead to real-world solutions that help everyone. It started with researchers studying a crystal's properties and has resulted in a technology that can make healthcare better, safer, and fairer. By providing doctors with clearer images, faster, and at a lower cost, the perovskite camera is poised to kickstart a new era in medicine. It's a future where every hospital has the tools it needs to see inside the human body with stunning clarity, saving more lives in the process. Consider the world changed.